Hello everyone, my name is Li Dong Chen. I'm from the Cancer Hospital of Shantou University Medical College. One day, my thumb was cut and it bled badly. What structures are injured in the skin of my thumb after the cut? What's the anatomy and functions of the skin? These are what we are going to talk about in this session. Impaired skin integrity is not a common problem for most healthy people, but it is a threat to the elderly and people with mobility problems. To effectively protect the skin and manage wounds, we must understand factors affecting skin integrity, the physiology of wound healing, and specific measures that promote optimal skin conditions. There are two parts in this chapter, skin integrity and pressure ulcers. Let's go through the first part about skin integrity this time. After this session, you should be able to attain the following objectives. Describe the functions of skin. Describe factors affecting skin integrity. And lastly, identify assessment parameter pertinent to skin integrity. First, let's look at the definition of skin integrity. Intact skin refers to the presence of normal skin and skin layer uninterrupted by wounds, covering 1.5 to 2 square meters. Skin is actually the largest organ of the body. Maintaining skin cleanliness is a basic condition for protecting human health. Before we discuss skin integrity, we need to learn the anatomy of the skin. Skin consists of 3 layers: the epidermis, dermis, and hypodermis. The epidermis is the outermost layer with an average thickness of 0.2 millimeters. Dermis is thick layer lying below, and hypodermis is also called subcutaneous layer or fat layer, composed of loose connective tissue and fat. Beneath the surface of the skin, there are nerves, nerve endings, sweat glands, hair follicles, and blood vessels. The sweat glands are on all body surfaces, except the lips and parts of the genitals. The body has 2 to 5 million sweat glands, which are all present at birth. My thumb bled a lot because the blood vessels were injured by the cut. Intact skin serves 6 major functions. First, it protects underlying tissues from infection by preventing the passage of microorganisms. The skin and mucous membranes are considered as the body's first line of defense. Second, it regulates the body temperature. Cooling of the body occurs through evaporation of sweat or when blood vessels of the skin are dilated. Body temperature is conserved by reducing perspiration and constricting blood vessels. And third, it secretes an oily substance, sebum, which softens and lubricates the scalp and skin. Sebum also reduces water loss from the skin. Because fat is a poor heat conductor, sebum decreases the amount of heat loss from the skin. It also has a bactericidal action. Fourth, pain, temperature, touch, and pressure are transmitted through sensory receptors on the skin to the brain. Fifth, when exposed to sunlight, the skin synthesizes and absorbs vitamin D. Lastly, the skin also has excretion function. What are the factors influencing skin integrity? Let's take a look at the first one, genetics. Genetics determine many aspects of a person's skin, including skin color and sensitivity to sunlight. Then we have the age factor. Older people are more vulnerable to injury than young adults, and wounds in infants and children heal faster. There are other conditions affecting skin integrity: immobility, diminished sensation, decreased mental status, inadequate nutrition, excessive body heat, and certain chronic disorders, as well as some medication, such as chemotherapy drugs. Skin conditions can reflect an individual's health. In its optimal state, skin is warm, smooth, soft, and moist without being greasy. There is no redness, breakage, lump swelling, and other signs of disease. We should conduct a comprehensive assessment of the patient after admission. We need to evaluate his or her self-care ability. It's important for the nurse to determine each patient's level of functioning and to maintain and promote patients' independence as much as possible. The nurse also needs to do a physical assessment of the skin. We should evaluate skin color, texture, turgor, temperature, intactness, elasticity, softness and thickness, sensitivity and cleanliness. We also need to check if there is any rash, petechiae, or lesion. The color of the skin varies and is related to genetics. However, there could be several pathological changes in skin color. First, pallor is common in patients with anemia or shock, while cyanosis, a bluish discoloration of the skin and mucous membranes, is a sign of low oxygen in the blood. Physiologic vasodilation makes the skin pinkish red after exercise and alcohol, but a rash or sunburn will cause pathological skin reddening. Phenochromia is yellow coloration of the skin and mucous membranes. Early and mild jaundice will usually start with yellowing of the sclera. Some chemotherapy drugs can increase pigmentation of the skin. So, can you tell me what skin structures were injured in my thumb after the cut? Yeah, it cut the epidermis, dermis, and damaged my small blood vessels. We have discussed the 6 functions of skin, factors influencing skin integrity, and some common abnormal colors of skin. And next time, we will introduce pressure ulcers, the most common skin problem in clinical practice. That's all for this session, and these are my references. See you next time. Bye-bye.